Hi everyone, I completed a clinical audit titled Unnecessary Sleepovers, identifying why urology patients stayed the night following their procedure. This audit was designed to increase same-day discharge rates following surgical procedures in order to address the ongoing increasing hospital strain faced by our facility. The objective of this audit was to determine the proportion of patients undergoing a day surgery appropriate urology procedure according to the British Association of Day Surgery that were not discharged on the same calendar day as their procedure, and then determine the reasons why. We included patients at Fiona Stanley Hospital, Perth, Western Australia over a 1-year period and included the surgical procedures in the table below. These were the surgical procedures as listed by the British Association of Day Surgery with the same day target discharge rate of greater than or equal to 75%. 234 patients met the inclusion criteria, 87 of which were discharged on the same day as their procedure. 147 patients were not discharged on the same day, and 9 of these had a medical contraindication to day surgery. This left 138 patients where we analysed the digital medical record to determine the reasons the patient stayed the night following their procedure. 38.7% of patients were discharged on the same calendar date as their surgical procedure, leaving 61.3% that stayed the night. The pie graph demonstrates the main surgical procedures. These included laser of kidney stones, insertion and removal of JJ stent, and cystoscopy plus or minus biopsy procedures. The graph on the right demonstrates the relatively low same-day discharge rates at our facility compared to those same-day discharge target rates listed by the British Association of Day Surgery. Our same-day discharge rates ranged from 15 to 65% when we excluded those procedures with low sample size. Interestingly, the mean and median length of stay was always around 24 hours for each surgical procedure in this audit, demonstrating that despite the low same-day discharge rates, patients were generally discharged the day following their procedure. Administration of IV antibiotics, awaiting trial avoidance, and social reasons were some of the main reasons patients stayed the night following their procedure. Interestingly, 20% of patients who were not discharged on the same day as their procedure arrived to the surgical ward after 6 p.m. Hence, we concluded that same-day discharge rates were reduced by late arrival to the ward at our facility, and we've recommended that patients be booked on the elective theatre list based on their likelihood of same-day discharge. Also, increased attention is required at our facility to preoperative planning in order to prevent patients staying for non-medical reasons. A further analysis of the appropriateness of IV antibiotics and indwelling catheter insertion is required at our facility in order to improve same-day discharge rates.